Andrea is an associate professor at Georgia Tech in the School of Interactive Computing. And some of you, I think Aditya knows Andrea, and some others may as well, as the founder and director of the Wellness Technology Lab at Northeastern University, right near here. Andrea's research bridges HCI, CSCW, and health informatics. And one of her passions is studying how technology can reduce socioeconomic health disparities, which is the focus of tonight's talk. And I'm really anxious to hear about this. You'll have the opportunity to ask Andrea questions at the end of the talk, but for now, please join me in welcoming her here tonight. And I will stop my share so Andrea can start hers.
Okay, do you see the full screen and not my presenter view?
Yes.
Okay. Great. So it's so fun to be here, even virtually. I was at Northeastern for many years before moving down to Georgia Tech. So I even seeing that little T map in the Miro was giving me fond memories. And it's really nice to see folks here going all the way back. My undergrad research mentor, Peter Tarasevich, is here, which is like so awesome. So hopefully I can make you proud, Peter, with this presentation. But yeah, really great to see lots of folks here. So thank you again for having me. So today I'm going to talk about some of the work that we have been doing in the space of digital health equity in my group. There we go. So in the United States and in the world more broadly, health and well-being are not equally experienced. Some groups experience higher rates of and barriers to poor health, such as racial and ethnic minority groups and low SES households. So let's look at some of the ways in which this fact gets manifested in the United States. So first, where you live in the US is predictive of your life expectancy. We see over 30-year gaps in life expectancy when comparing different parts of the United States. And these gaps can also be seen at a much more finely grained level as well. So this is a map of the Atlanta area, and it shows that people living just miles apart have large differences in their life expectancies. So living in a low SES neighborhood means that your life expectancy is 13 years less than someone living just miles away in a more affluent neighborhood. And we also see large differences in well-being when looking at different racial and ethnic groups. So for example, if we take the topic of obesity, we know that obesity is a serious health condition that is associated with poor quality of life, lower mental health, and a whole host of physical health issues like diabetes, stroke, and some forms of cancer. And so here we see that over the years, obesity rates generally have risen. But drilling down, we see that the burden of obesity is not evenly distributed. So Hispanic and Black adults are much more likely to be obese than white adults in the United States. And if we look at children, we also see that rates of obesity have been increasing all over the world for the past few decades. And yet, again, we see that obesity is not equally experienced across populations. So for example, socioeconomic status matters for children's health. Children in low-income households are more likely to be obese than children who are in higher income families. And of course, we've seen health inequities further magnified amidst the COVID-19 pandemic, with communities of color and low-income households experiencing disproportionately high rates of COVID-19 morbidity and mortality. So the fact that these significant and persistent disparities in health exist mean that as a society, we have failed to achieve a state of health equity, which means a state in which everyone has a fair opportunity to live a long and healthy life. And so my work is focused on exploring how technology can help us achieve health equity, that is, the creation of fair opportunities for health and wellness and the elimination of gaps in health outcomes. So achieving health equity requires creating interventions, or in the case of my work, health technologies that address the many influences on health. So this is a model of health disparities that my colleagues and I created, and there's a lot happening here. But the main takeaway is that improving health and reducing disparities is a complex endeavor due to the varying and intersecting influences on health. So at the micro or individual level, behavioral and psychological factors shape health and well-being directly. For example, regular physical activity is important for well-being. Then at the mesosocial level, social and community networks, living and working conditions, these can all act as facilitators or inhibitors of the behaviors that contribute to well-being. So for example, families are important social environments for encouraging positive physical activity behaviors and then the associated health benefits that come with such behaviors. And then at the macro level, social, political, economic, and cultural mechanisms create unequal exposure to factors that inhibit wellness, such as experiences of stigma, racism, and unequal distribution of resources. And so together, these macro, meso, and micro level determinants of health help to illustrate the complex challenge of trying to improve the well-being of marginalized and underserved groups. So given these determinants of health, my work has explored how information and communication technologies can promote well-being by empowering communities to collectively engage in micro, meso, and macro level change. And I define communities as groups with shared geography, interests, or characteristics. And this whole area of work I call community wellness informatics. And so why focus on communities specifically? Well, they offer several unique affordances for improving health and wellness. For example, community members' shared identity offers opportunities for mutual understanding, support, and cooperation. Additionally, interventions that rely on individual effort alone have been shown to be less effective for marginalized and underserved groups, and this is because of these social determinants of health that I've discussed. And so in our group, the Wellness Technology Lab, we've explored how interactive computing systems can be designed to achieve health equity. We've explored how technology can support various kinds of communities in pursuing increased well-being by empowering them to address health influences that operate at the micro, meso, and macro social levels. And an important part of this work has been using insights from formative, often qualitative investigations to build and deploy interactive computing systems. And through naturalistic evaluations of these tools, our work has tried to establish design recommendations for how platforms such as mobile health applications, digital games, and family data visualization tools can better support health in community contexts. And so today I'll talk about 3 threads of work we've done to focus on community-based approaches to health equity. So first I'm going to provide an overview of the landscape, how prior work has used technology to promote health and well-being in marginalized and underserved groups. And I'll use these findings to lay the groundwork for the rest of my talk, focus on mesosocial and macrosocial change. So increasingly, researchers have been exploring how mobile technology can address issues of health equity. Mobile platforms such as smartphone devices are increasing in prevalence, even across socioeconomic groups. They're often relied upon for internet access in groups that disproportionately experience health problems. They travel with people into the varied settings in which health decision-making happens, and they enable network support. So we conducted a systematic review to examine in what ways mobile health or mHealth tools have been designed to promote well-being in underserved and marginalized groups. What works, what doesn't, and what gaps exist. Our review focused on mobile health technology designed for lay people or patients, so not clinicians or health providers, and low SES in racial and ethnic minority groups. Our goals were to characterize the research landscape and opportunities for future work, and through iterative database searching and article screening, we developed a final corpus of over 80 papers that we conducted a qualitative analysis and meta-analysis of. And through our analysis, we found that the vast majority of papers in our corpus reported on the design and evaluation of mHealth systems that were designed for individual use. This is despite social contexts having powerful influences on health behaviors and attitudes. And then carrying on from this finding, we found that few interventions were designed to address the physical and/or social environments that impact health. Instead, most studies evaluated tools that provided informational support, for example, the delivery of expert knowledge, or behavioral support, for example, goal-setting mechanisms, that is, influences on well-being that operate at the individual or micro level. Our meta-analysis assessed how well the randomized control trials in our corpus improved the health of study populations. And while we identified moderate success in weight change interventions, this was largely due to one study in our corpus that did particularly well. However, for the other outcomes that were measured in the studies, body mass index, as well as HbA1c, which is a measure of how well blood glucose is being controlled, the studies did not demonstrate a positive overall effect on outcomes. And so overall, we did not find that evidence that the interventions in our meta-analysis had successfully impacted the health outcomes of the marginalized and underserved groups that were studied. So one reason for this is likely the consistent finding across studies that there was waning use and engagement with the applications that were evaluated. As other studies have found, users of these systems quickly became disinterested in them and stopped using them. And so the findings from this review have highlighted several unanswered questions and under-investigated design spaces within the health technology research community. So for example, more research is needed to investigate how technology can support meso macro social change, as well as how to design for richer engagement with these platforms. And so today I'll discuss some of the projects we've done to try to address these gaps in research. So first, I'd like to share some of our work focused on mesosocial change. So over the past several years, we have examined how interactive systems can be designed to go beyond an individual level of focus to engage and facilitate change within families, with a specific attention to micro and meso levels of influences on health. And so, we know that physical activity is incredibly important for health behavior. It's an incredibly important health behavior. It helps prevent and manage chronic disease and supports mental health. However, low SES households face serious barriers to physical activity. So for example, at the neighborhood level, low SES communities typically have less access to safe play spaces for children to be active outside in. At the household level, there's less likely to be positive parental modeling of physical activity. That is, instances where parents are able to engage in physical activity in the presence of their children, showing that it is valued and demonstrating how it can be done. And this is, again, in large part due to the barriers to physical activity that low SES households face, like demanding and inflexible work schedules. And yet, parental physical activity modeling is crucial for the development of positive physical activity attitudes and behaviors in children. And because of the important ways in which family environments shape child physical activity, family-focused interventions are critical for supporting increased physical activity in kids. Yet such interventions are less common than interventions solely focused on adults or solely focused on children. Now, physical activity tracking tools are increasing in prevalence and offer one opportunity for health promotion, as they help people collect data about their fitness levels. Reflection on this kind of data can be beneficial for health by supporting increased self-awareness and self-management of progress towards wellness goals. And various efforts have been made to explore ways of subsidizing activity tracking costs. For example, through a Fitbit and Georgia Medicaid partnership that provided trackers to qualifying patients with diabetes. Now we know that these fitness platforms are prevalent, but not how they can be made engaging and useful for families, especially those who face extra barriers. Additionally, as our systematic review showed, figuring out how to motivate engagement with these kinds of platforms is a challenge that has yet to be solved. And so our work has examined how socio-technical innovations can address these issues, specifically how technology can transform personal health data in ways that are engaging and useful for low SES families. So to begin exploring this research question, we designed, built, and deployed a collaborative digital game and fitness data dashboard to promote family fitness data reflection and encourage increased physical activity in low SES families. The system we built is called Spaceship Launch. To use it, parents and kids wear wristbands that track time spent in moderate and vigorous physical activity levels. The more time the family spends being active, the more fuel the child earns to launch their spaceship to distant planets. And then throughout the week, the family has access to a data dashboard that visualizes their activity levels. This is what's shown on the screenshot on the left here. And then a trivia mini game shown in the middle here allows families to earn more fuel points by reflecting on the relationship between their specific physical activity bouts and caloric burn. And then once a week, families are able to access the Spaceship Launch game at an interactive display we installed in a community center in a low SES area of Boston. This center provides a free, safe space for families to be active together once a week. So we conducted a formative study to design Spaceship Launch and an evaluation study to assess engagement with the platform and families' perspectives on how it could be expanded on in the future. So one question that we explored is, what is the social value of personal health data? In this case, the personal health data conveyed the time that families spent engaging in moderate and vigorous physical activity. And we found that beyond just serving a cognitive purpose, for example, enabling self-awareness of behavior, caregivers saw data as a valuable resource for nurturing social capital. So parents discussed the value of comparing and discussing their activity data with their children, such as the bonding that can be facilitated as activity data is reviewed, and parents help their children develop physical activity self-confidence. As such, these data-grounded interactions were seen as opportunity to nurture relationships within the family. And then participants also discussed how they felt Spaceship Launch could be expanded to support competition with other families in their neighborhood. They were excited about this prospect, not just so that they could outdo one another and have fun. They also felt that the data comparisons that would arise in such a scenario could help to open up opportunities for dialogue between families and meeting up in real life. And this was really valuable for us to see because in our formative work, families talked about how, despite this center providing this space for families to come and be active and meet one another, they actually weren't building the relationships with other families that they wanted. And so they saw this platform as an opportunity to help open up those opportunities to broker relationships and deeper relationships with those in their community. So building on these findings, we began exploring how physical activity promotion tools can create these kinds of opportunities for nurturing family relationships, especially in low SES contexts. And we identified storytelling as one promising venue to explore, given the way in which storytelling has long been a way to support family connectedness and the transmission of values. And so to this end, we iteratively designed an app called Storyweil. Storyweil integrates literacy promotion and physical activity promotion and seeks to nurture family relationships through physical activity grounded storytelling. The way it works is that parents and their young children wear physical activity tracking wristbands. They set physical activity goals, which we call family challenges, and they can monitor their progress towards these goals in an engaging visualization, which is shown in the second screenshot from the left here. If they complete their family challenges, they unlock what we call social rewards. These are digital rewards that support social interactions within families. Specifically, families unlock an interactive storybook chapter that they can read together. These storybooks have embedded physical activity themes, as well as reflection questions that invite families to tell and record their own stories recounting their physical activity experiences. And through these features, Storyweil has the dual goal of supporting meaningful experiential learning from physical activity data or micro-level change, and supporting family social capital building, that is the building of positive relationships within families or mesosocial change. We conducted a 3-month study to evaluate engagement with Storyweil. And one of our key findings was that Storywell succeeded in building in caregivers' interest and motivation to use the system because it provided 3 kinds of satisfying moments for caregivers to have with their children. These moments helped nurture connectedness within the family, a social process that is key for supporting intrinsic motivation to use fitness promotion technology. So first, it provided bonding moments as caregivers felt closer to their children through the completion of family fitness challenges, unlocking and utilizing the social rewards, that is the storybook chapters, and responding to the reflection questions with their children. And in these bonding moments, connectedness was supported as caregivers were able to notice their child's positive emotions while spending time together. So for example, one mom discussed how Storyweil encourages physical closeness because it naturally brings the family next to one another as they read the stories on the phone. Another mom described her daughter's joy at unlocking rewards and the satisfaction of being able to share in that joy with her. And these bonding moments produced an immediate sense of emotional satisfaction. Another type of satisfying moment was discovery moments. These moments with the app were valued because they helped parents to observe their children's needs, behaviors, and attitudes in ways that help them see how to further care for them. For example, caregivers appreciated being able to witness their children's physical activity and reading behaviors and ways in which they could further support each. And I refer to caregivers as the adult participants in these studies. Predominantly they were parents, but sometimes grandparents. So for example, one mom described her family's interactions with the app as being beneficial because as her son was answering the reflection questions, she realized his extreme confidence makes it difficult for him to handle failures and challenges in physical activity. So these discovery moments produce a satisfaction that was realized in a longer term sense than the bonding moments I discussed in the previous slide, as they helped provide caregivers with insights that allowed them to start identifying ways to provide further care to their children. And lastly, caregivers valued the educating moments that Storywell provided. These were experiences with the app that helped them build skills in their children and pass on life lessons. For example, one mom described appreciating how the interactive storybooks helped her son build his language skills, while another mom valued that the app helped her sensitive child to see that he was not alone in going through life challenges. These kinds of educating moments provided satisfaction that, again, is more long-term in that they help to build up children's character and literacy skills in ways that can benefit them into the future. Identifying that Storywell supported these various moments was especially important because they aligned with self-determination theory, a theory that helps explain human motivation. Each of the 3 moment types supported a feeling of relatedness, which means a feeling of being connected to or caring for others. Self-determination theory tells us that when interventions help engender this feeling of relatedness, that can help to build intrinsic motivation to engage in the healthy behaviors and to engage with the intervention itself. Now, these kinds of bonding, discovery, and educating moments would likely be valued by many families, but they were especially important for our families who had experienced much adversity in their lives. The discovery and educating moments in particular were important for our caregivers given the missed opportunities they had personally experienced. For example, one caregiver discussed growing up in foster care and without family to help her through life. This experience led her to want to provide a different life full of support for her own children. Another caregiver discussed the challenges she has experienced in her life due to her racial identity. And in summary, caregivers experience various missed opportunities to a host of factors, including racial discrimination, challenges associated with their immigration status, and other challenges such as those arising from growing up in the foster care system. And so Storywell was valued because these moments helped them achieve their goals of providing opportunities for their children that they did not experience themselves through small moments of discovery where they identified ways in which they could provide further care for their kids and brief educating moments through which they could help their children to engage in learning experiences that would help them achieve their goals. And these findings helped highlight the importance of designing health technologies that align with the broader goals and aspirations that families have for their lives. While the data that Storywell collected and visualized was helpful for spurring behavioral goal setting and change, this alone was not what made the app truly compelling for families. It was the bonding, discovery, and educating moments that the various features in the system created for families that really drove motivation to engage with Storywell. So while the findings I've shared thus far have reported on the benefits that family-focused fitness tools can have for low SES families, we have also investigated the challenges that these kinds of tools present. For example, we conducted a study to more fundamentally examine how well commercial fitness tracking tools support physical activity in low SES families. We gave parents and children activity trackers to wear for 2 months and installed the companion mobile apps on their phones. Now, as we examined the viability of these trackers for families, one neighborhood barrier we identified was community safety. Almost all of our caregiver participants expressed neighborhood crime and safety concerns. For example, concerns around shootings, drug abuse, and local gang activity. Crime was clearly a prevalent concern. And one participant discussed how this safety concern served as a barrier to adhering to the Fitbit notifications that would encourage her to get up and move to achieve her step count goals. She said that she ignores those reminders because if she listened to them and took a walk around her block, it might be her last walk due to the crime concerns and the safety concerns in her community. And yet, we also saw resilience to these safety concerns, with many parents describing reasons why, despite these concerns, they felt comfortable with their children being active outside. Participants discussed how they viewed their community not only in terms of its physical attributes, but also the local social connections they have, whose presence is instrumental in building their confidence in their children's safety. And so some participants developed these sort of mental maps of safe territories in their communities, which were defined by the social connections they have in those locations, as a way to identify places where their children can be safely active outside. And this finding helps to emphasize the importance of socio-technical interventions that not only seek to support family physical activity through features like nudges to be active. Helping families to actually build up neighborhood social capital is also another important avenue of work to create neighborhood environments in which families feel safe and able to be active. And so building on this theme, we created a second version of Storywell that attempts to build neighborhood social cohesion by helping families to share their stories of pursuing physical activity locally in their neighborhoods with others in their communities. In a 4-week pilot study, we identified the ways in which these shared stories impacted caregivers' beliefs about physical activity, such as the extent to which physical activity is valued by peers in their community and their own ability to be active. And in our future work, our goal is to assess how well Storywell can help to build neighborhood cohesion, that is, feelings of connectedness, solidarity, and trust amongst neighbors. And so in sum, this work around family physical activity promotion suggests several ways in which personal health data can be made engaging and useful for low SES families. At the meso level, our work suggests the importance of creating systems that use personal health data to support relationship building within and between families. These kinds of relationships are critical for providing social support for healthy behaviors. And our work has showed the value of narrative and storytelling for augmenting data-driven systems and supporting valuable moments between parents and children, including the bonding, discovery, and educating moments I've described. And lastly, it's important to design socio-technical interventions that help people build social infrastructure within, but also between families, as an important way of helping to create social environments that help mitigate crime concerns. So in addition to the meso-social change that I've discussed so far, our group has also explored how technology can support macro-social change. For example, our work has studied how technology can help engender community participation in social action that actually tries to confront the social determinants of health that serve as barriers to well-being. So the first project I'll discuss has focused on studying the Me Too movement. So in this project, we have studied sexual violence and the stigma associated with these experiences. So sociologist Irving Goffman describes stigma as an attribute that a person has that is deeply discrediting and that reduces them from a whole and usual person to a tainted and discounted one. And it is the stigma associated with experiences of sexual violence that keeps many survivors from disclosing their experience. Many fear not being believed, being punished, being blamed, or that nothing will be done. And stigma influences health through various pathways, for example, through the stress that it puts on survivors. And yet, disclosures can be beneficial for survivors, for example, by opening up opportunities for support, healing, and recovery. Online platforms offer opportunities for social support. So, for example, online communities like Reddit forums have enabled support seeking in an anonymous way. And in October of 2017, the hashtag #MeToo rapidly spread across Twitter and Facebook. And this viral movement built upon foundations laid down by activist Ronna Burke over 10 years before. The 2017 movement was catalyzed as actress and activist Alyssa Milano posted a rallying message that invited others to signal that they had been sexually harassed or assaulted by tweeting hashtag #MeToo. Through these tweets, a goal of the movement has been to, quote, give people a sense of the magnitude of the problem. The Me Too movement has functioned as a direct challenge and attempt to dismantle stigma surrounding experiences of sexual violence and disclosures of those experiences. Interestingly, in comparison to online forums like Reddit, in which anonymity functions as an important attribute for catalyzing stigmatized disclosures, Me Too blurs the boundaries of public and private by helping people to share experiences publicly, but through often personally identifiable accounts to a varied network of followers. So my collaborators and I have been investigating the mechanisms driving participation in the Me Too movement. We analyzed a sample of tweets and replies to tweets from the first 2 weeks of the Me Too movement. And we've used mixed methods to characterize trends with a particular focus on acts of disclosure and when individuals chose to go beyond using the hashtag #MeToo and include more description of their experiences. And so in this project, one of the questions we wanted to explore was, were Twitter users more likely to simply tweet the hashtag #MeToo as the initial call invited, or to tweet more? And we call a non-descriptive disclosure simply tweeting the hashtag #MeToo, because using the hashtag is a way of disclosing to the public that one has experienced sexual assault. And then we call a descriptive disclosure a tweet that has the hashtag #MeToo and additional text that helps describe their experiences. And we found that nearly all users were more likely to make a descriptive disclosure than a non-descriptive disclosure, regardless of follower network size. So regardless of the number of followers that one has. And this was surprising to us because we hypothesized that perhaps if you have a very large group of followers, you might be more likely to just tweet a descriptive disclosure because of a sense of responsibility you feel to sharing your experience and using your platform in that way, or maybe you might be less likely to share details because of your public visibility. And we defined potential exposure to disclosures as the number of times there were disclosure tweets by people that a user is following. So we couldn't know, of course, how many of one's follower networks, how many of those tweets someone saw for sure, but we could quantify potential exposure. And so we found that greater potential exposure, so the more you had people in your network tweeting disclosures, the more likely you were to tweet a descriptive disclosure yourself. And so we found that this effect happened most strongly when Twitter users went from having no one that they followed who tweeted a disclosure to having a single person that they followed tweeting a disclosure, showing the power of even one person in a network sharing their experiences. And lastly, we found that descriptive disclosures beget descriptive disclosures. So people's likelihood of making a descriptive disclosure increases the most when people they followed made descriptive disclosures themselves. And so to summarize, we explore this question of how can technology increase participation in social action that confronts the social determinants of health. And one powerful social determinant of health is stigma. And our findings highlight how exposure to sexual violence disclosures on Twitter was key to driving people's participation in the Me Too movement. And these disclosures, this participation in the movement, helped create an environment that worked to counter, in some way, the stigma associated with sexual violence. And in this last project I'll present, we have been exploring how social networking apps and social computing platforms more broadly can directly support youth participation in activism. So there's been much optimism for the power that social media can have for increasing youth participation in civic engagement. So for quite some time, researchers and practitioners have sought to explore how, how we can design programs, interventions that would actually empower youth to participate more in civic matters. And social media is seen as a promising type of platform because youth use them frequently and they give youth access to often large networks that can be mobilized. And yet, questions remain as to how well-founded this optimism is, challenges that youth face in using these platforms to engage in activism that counters barriers to well-being, and what opportunities there are for creating technology that can better support youth. And so we have been studying social computing use and potential for use within youth empowerment organizational contexts. Youth empowerment organizations and programs exist around the world, and they help youth identify and address problems within their communities. And while there is a growing literature characterizing trends in youth participation in online social movements, little work has explored how youth within these empowerment organizational contexts use technology to support their work. The organization that we have been working with specifically empowers low SES and youth of color to identify social issues in their communities and to address these challenges. Within the program, youth aged 14 and 21 seek to educate and mobilize their peers to address societal issues like racism and youth-police relationships. We've conducted various qualitative and participatory design studies to understand current use of social media amongst these activists and opportunities for the design of future systems. Our findings have highlighted some ways in which youth empowerment organizations help to facilitate youth's use of social media for activism. For example, within the organization we studied, youth use social media to promote their events and encourage their peers to come to these events. The video here is an example of a video shared by youth in the organization we studied to give their communities a preview of an upcoming artistic event. In sharing videos and other content on social media, youth in the organization attempted to mobilize their peers to address community health issues at the meso and macro levels. And yet youth described the negative feedback that they received from their peers when posting this content. For example, being called a goody-goody or a snitch for engaging in work that partners with the police. And we saw that these youth exhibit great resilience in the face of the negative feedback that they often receive to their online posts. And this resilience is in large part a testament to the support that the organization provides youth to build up their identity and confidence as youth activists. And indeed, youth described how encountering conflict from others in response to their activist efforts was a source of empowerment, making them want to work even harder to pursue their social justice goals. And yet, youth face challenges as well. First, youth are initially recruited into the organization such that the demographics of the activists reflect strategically the composition of the youth in the communities from which they're drawn. And so the youth activists begin with many of the same perspectives on social issues as their peers. They come from similar social circumstances and face many of the same challenges. However, these youth evolve as part of their work in the organization, and their perspectives on shared social issues evolves. while many of their peers remains the same. And this creates a disconnect between youth inside and outside of the organization. For example, through the youth police dialogues that youth host, they begin to see the importance of healing the friction between youth and police, and they increase in their sense of confidence in their own ability to address the issue. Yet their peers outside the organization may remain unpersuaded of, for example, the importance of improving police-youth relationships or their ability to play a role in such change. So when the youth activists post a flyer on social media for an event they're hosting, their peers may not see the value of attending. And this in turn inhibits their ability to successfully convert their online activism into offline participation in their efforts. Additionally, we found that when youth would post content online in an effort to mobilize their communities to action, these messages were typically posted in a broadcast fashion with limited strategic thinking about their online networks' affordances and how to leverage these affordances to accomplish their goals. And indeed, this type of network thinking is not typical for anyone who's on social media. And yet technology does offer us the opportunity to support this more strategic thinking and more strategic online social action. And so motivated by this finding, we've conducted work to examine how social network visualizations can help support more strategic use of social media amongst youth activists. In particular, we've explored how visualizations of features of one's social media networks can help youth understand the ways in which these networks can be engaged more strategically for civic action. And so to start exploring these questions on the screen here, we interviewed youth at an empowerment organization. And during each interview, we asked youth to examine interactive prototypes that visualize their hypothetical network of Twitter followers. We use these visualizations to see discussion around the kinds of information about network connections that youth felt would help them to engage, could help them to engage in informed outreach efforts. The visualization prototypes showed information about youth's followers, information such as their age, how active they are on social media. In addition, one of the visualizations, the followers most frequently used hashtags. And our findings highlighted the important role that hashtags play in helping youth activists make sense of their social networks and make sense of how these networks can be more effectively engaged in civic action. For example, they use the hashtags to assess to what extent their followers were aware of social issues. And youth made these inferences naturally and without our prompting in the interviews. We only asked them to discuss what they saw in the visualizations and to use this information to choose people that might be important for their work of outreach. We also saw that participants use the hashtags as a kind of screening device for identifying who they would want to reach out to. For example, participants discussed using the hashtags to identify their followers' interests and thus who might be interested in the causes of their organization, as participant 13 describes here. In addition, they discussed using the hashtags to identify who might have heterogeneous networks that would support greater impact. For example, as P8 describes here, this participant describes using information about a follower's hashtags in combination with information about that person's network to identify people who have the potential to act as connectors to individuals with different ideas. However, we also identified one challenge with network visualizations that communicate hashtag usage. Specifically, we found that as youth naturally inferred meaning from this information, they were doing so based on a very incomplete presentation of information about their network. That is, seeing a follower's most used hashtags does not paint the full picture of their hashtag use. And this incomplete presentation caused issues in a couple of ways. First, issues arose in the presence of the limited data they were presented with. When viewing their followers' most commonly used hashtags, some participants drew meaning from the fact that these contexts did not have certain hashtags listed. For example, when a follower did not have hashtags about social justice issues listed in their top hashtags, participants assumed that the follower was unaware of these issues. However, of course, just because a hashtag doesn't show up in the most commonly used hashtag list, that doesn't mean that that person doesn't use them or that they don't care about those issues. And in this case, the design decision made in the visualization To only show followers top hashtags as opposed to more complete information might have limited participants' decision-making about their followers. And given that our participants mainly focus on using hashtags to identify those with like interests, this kind of visualization has the potential to cause youth to ignore audiences who do not use online platforms to discuss and advocate for these issues in ways that they would expect. And so our findings point to several ways in which information and communication technologies can increase youth participation in social action. First, tools are needed that help bridge the gap between youth who are seasoned activists or those who are part of community organizations that provide support to activists, bridging the gap between those individuals and youth within the broader community. One way of doing that may be tools that provide a greater window into the evolutionary processes that youth activists go through as they learn about and engage in efforts to address issues of social injustice. Second, our work suggests the value of technology that helps youth to gain more insight into the social capital within their networks to support more strategic activism. This kind of work will need to mitigate against misanalysis that can arise from the ways in which network information is visualized, and to specifically explore ways of helping activists identify people who may be open to engaging with their causes, but who may not easily fit the typical or expected profile of a supporter, for example, because of their use of particular hashtags. And in this vein, we have developed an app that provides this kind of network visualization. It's called the SWAG app. It was named by the youth in our studies, and its goal is to help youth activists think strategically about the social capital within their networks. Visualizations of network node characteristics help you think about the relative affordances of these nodes and who to engage in their social media posts. Part of our planned future work is to evaluate this app in the context of youth empowerment organizations to examine adoption, user experience, and the impact on individual and collective efficacy for engaging in activism. So today I've discussed how our group has used a variety of methods to identify how interactive computing systems, techniques, and platforms can directly address micro, mesosocial, and macrosocial determinants of health. These case studies help to illuminate design opportunities, findings, and open questions in this space of community wellness informatics. And I'll conclude with a few directions for future work. So first, community wellness informatics is fundamentally about examining how technology can empower collectives to engage in micro, meso, and macro social change. A key direction for future work will be to systematically examine how to connect and empower neighborhood residents with shared group membership to engage in change. Designing tools that work in tandem with community organizations is important for building trust in these systems and providing social supports that can make them even more effective, as we saw in the case of the Youth Empowerment Organization, providing support that was instrumental in youth's ability to be resilient to negative pushback online. Creating these kinds of tools will necessitate studying social, organizational, and physical characteristics of such community entities and implications for design. Furthermore, there is a need for increased upstream research, that is, work examining how technology can actually operate at the mesosocial and macrosocial levels to support change. And what might this kind of socio-technical work look like? Well, for example, there's a need for more work examining how technology can help communities to challenge the status quo. Of course, we've seen how existing platforms such as social networking tools can amplify social action. And there is a need for work that investigates how well these kinds of tools are supporting action amongst marginalized and underserved groups in particular, and how they can be designed to do so more effectively. The social network visualization work I described today is just one example of such work. There is also a rich and underexplored design space examining how technology can help communities to study, critique, and raise awareness about equity issues within their communities. And lastly, designing tools for and with vulnerable and marginalized groups is not enough. We need to be examining to what extent the systems we create are laying the groundwork for systemic long-term change. This will require socio-technical solutions that aim to build up social, financial, human, and social, financial, and human capital in populations that are marginalized and underserved. For example, tools that seek to not only nudge behaviors in the moment, for example, prompting someone to take more steps, but that also provide experiences with the technology that build long-lasting skills, values, and environmental change. For example, the kinds of bonding, discovery, and educating moments that arose in our Storywell project that helped to build family capital. So I'd like to conclude by thanking the many students, collaborators, community partners, and funders that have made this work possible. I'd like to specifically thank Dr. Farnaz Ranajabdisafar, Dr. Herman Saxono, and Lily Stoll, the current and former doctoral students who led the work I discussed today. And thank you very much for listening.
There is a question in chat from Kim Trumbull, and people can also raise their hands to ask questions. But Kim said, great presentation, so much information. Have you investigated how clinicians can be better supported in encouraging various types of community wellness activities?
Yeah, that's a good question. So the majority of our work has been done outside of a clinical setting, but some of the work we're doing now around women's health, we are investigating this question. So we're doing some work around maternal health promotion and addressing maternal health inequities, specifically the disproportionately high rates of maternal mortality and morbidity in Black women and rural Black women in particular. And so we are in the process of designing a tool to support postpartum care. And so part of that is trying to understand clinicians' perspectives on, when women come into their practices, what are the primary barriers they're experiencing to well-being, the barriers that clinicians experience to providing effective care, as well as ways in which they're succeeding. So that work is looking at that. It's been interesting. Some of what we're seeing there is, a limited appreciation for the structural factors that lead to health inequities, and a real focus on individual level factors, and so which is a concern. You would hope that in a clinical setting there would be a more holistic appreciation, and this certainly varies across health providers, and this was a small sample, but it really spoke to the need to address in the clinical setting, even like fundamental perspectives and framing of the issue, to recognize that, as I was presenting, there are many levels of influence, and it's not only about sort of, convincing a woman to, go to doctor's follow-up appointments or eat more healthfully or be more physically active in this context, but there are actually, structural challenges to even accessing care, or experiences of discrimination and racism that are contributing to the stress that these women are experiencing, that are leading to the more downstream effects. And so, I think that's a area right for addressing further.
There is a question, someone with a hand raised. I'm looking now. It's Aditya. You can pose it.
Yeah, thank you for the talk. Thank you for coming to BostonCHI. My question was related to the storybook-based interventions. For them to really have a long-term engagement, like something that lasts like a year or two, it looks like it would require a lot more stories or a very continuous stream of content generation for it to be engaging. So what do you think is the strategy to generate that content, also so that while people are using the app, they're also not bored of the stories?
Right, that's a great question. So yes, so Herman, whom you know, former student who led the project, spent a considerable amount of time iteratively developing those stories with parents and other subject matter experts. And so yes, even getting that initial content for the app took a long time, and that process is not necessarily scalable. So various thoughts here. One, with the young age group that we were targeting, one thing that works in our favor is their love of reading stories again and again. I see this in my own children. The number of times I've read the various books on their bookshelf is, I don't even want to talk about it. And so I think that would be a benefit. So sort of cycling through different, stories, locking a story, and having to engage, meet your goals to unlock it again. So I think that's one thing. Other things we've thought about are maybe like crowdsourced approaches to story content generation, engaging communities in, writing stories. I think that would be really powerful actually to create a platform that could support the collaborative authoring of these storybooks in the community. So it's not just like some random story that has come from, not random, it was very systematic development of them, but not just stories coming from the sort of research team in collaboration with the community, but literally even more so coming from the bottom up. Those are some ideas.
Thank you.
Mm-hmm.
Owen Hendricks had a question. Biodigital devices are being used to monitor diabetes, hypertensive patients. How would you see the impact on addressing health disparities?
Yeah, so certainly lots of opportunity there. So I know, much work looking at various kinds of automated monitoring to support individuals with chronic diseases in improved self-management. So I think there's a lot of opportunity there. Looking at the individual level, like I was talking about, in terms of just helping people be more aware of the trends, seeing relationships between the impact of their behaviors, their eating decisions, for example, on their glucose levels. I think there's a lot of opportunity there, but I would still say, and lots of researchers studying this, I would still say that to make them have even greater impact, it's sort of like, okay, and how can we wrap that in other kinds of interventions that address the other reasons why that chronic, they have that chronic disease in the first place, or it's hard for them to manage it. So connecting the use of those automated sensing platforms with community interventions that maybe provide more access to healthy foods, or thinking about social interventions that help create social networks of support, where an individual who's managing their diabetes is not doing it alone, but in connection with others who are not only have diabetes, but maybe experience the same particular barriers to managing their diabetes. So
I was wondering, with in this past year, it looked like for your Storywell project that was done, well, it was for CHI 2020, so probably pre-COVID for the studies. I was just wondering if, after parents have been home with their kids on Zoom all day, if you anticipate they'd be less interested in getting involved in something like that at this point, or more interested in if there's some way to work through the schools with doing some of that, or just to get, I love the idea. I thought it was really great. And just to build up people using it. I just didn't know if this past year has turned everyone off from looking at Zoom and from engaging as a family together.
Yeah, so I mean, generally, that is always the fine line we're trying to walk here. With any of the tools we create, but especially those that engage kids, is like, how do we provide just enough interaction with the technology so that it's effective, but certainly we don't want them, you know, having tons of screen time. And so, like for Spaceship Launch, for example, the game was installed at the community center, and families could only access it once a week. And then even when you got to the game, it was like a brief interaction, and then it encouraged the kids to go like run around and do something else. So I think that is important to keep in mind. But with this in particular, we did actually the evaluation of the second Storyweil system we did in the first phase of the pandemic. And at that point, I think families were excited to have something to do and have, you know, have something to engage the kids with. But that is a good question of, you know, this sort of, now that we have all of this Zoom fatigue, what does that look like? It's hard to speculate, but I think, you know, continuing to have this principle of designing for the least amount of interaction with the technology that's needed would be important. But yeah, that would be interesting to ask parents about their level of interest in these kinds of tools post pandemic, and then how long that lasts. I think we're you know, of course, lots of theorizing about the impacts of the pandemic on us, but you know, it might be that there's this, you know, somewhat brief period of fatigue, and then, you know, eventually a willingness to engage more with the technology. But yeah.
Thank you. Does anyone else have a question? I'm not seeing any hands raised or chats, except for my cat, but anything, anyone else? Okay, in that case, I guess we'll wrap up, but thank you so much, Andrea. That was great. I'll have to watch the video to hear your future work, but the projects are fabulous, and I'm so glad that you were able to join us tonight. Thank you.
Thank you so much for having me. This was really nice.
Great, and thank everyone for, this was our last meeting of the 2021 season, and hopefully you'll be back in the fall, and we'll be in touch over the summer, but thank you all for joining us.